Welcome to my pitch video. My name is Tamlumi Agudi. I'm the founder and CEO of Monimiz Healthcare company. We're a healthcare data analytics driven company and also access. Today, I'll be sharing my pitch video about why you should invest in Monimiz Public Health Company. Monimiz Public Health Company, we're going to be dealing with four major problems, although we still have more problems that we're going to be tackling. First of all, we're looking at the limited access to healthcare resources in underserved communities, significant disparities in healthcare outcome driven by social determinants, inefficient use of public health data, and rising healthcare costs and overburdened providers. Our solutions to these problems are real-time localized healthcare data mapping down to the individual household, AI-powered analytics providing insights of healthcare outcomes and trends, empowerment of healthcare providers, NGOs, governments with actionable data, and also the individual with actionable data. Basically, what this means is that we're going to provide an app that shows the data of every individual, localized household, and all these are real-time data from basically your healthcare provider, from the individual himself, from wherever the healthcare data is coming from, we are gathering it up and we're using advanced AI to do the analytics to bring forth a new perspective on data. The healthcare disparities and data inefficiencies. This is why I went into this, because I worked with Oregon health authorities and I saw the inadequacy of how we use data to get good outcomes. First of all, the 25% of rural population lack adequate healthcare resources. So because with data mapping, we can show what healthcare resources are missing in whatever rural area it is in Oregon or Seattle or wherever it is in the US. There are disproportionate maternal mortality rates in undeserved regions. For example, in places that have high Black population, the maternal mortality rate is higher than places that have low Black density of population. So we want to try to force the healthcare, because of the insights, we try to force the healthcare companies and healthcare providers to merge this data into one where the, the maternal mortality rate is equal or the difference is insignificant. But right now, the differences are not insignificant. So we see that Black mothers die at higher rates, 2 times the rate as white moms when they're going to give birth. So this is a problem. With these data insights, first of all, the women that are going to give birth to their children, we already know that this hospital has a high mortality rate. So they might not go there. And since the hospital or the provider is losing patients because of the healthcare outcome in their hospital or their clinic, it makes their board and the head of the healthcare provider adjust to meet the requirement of Black mothers if they are coming to give birth in their areas, and listen to them more. 50% of patients are unable to access specialized healthcare providers due to geographic limitations. So why I'm putting this as one of the things we need to tackle is like if you're moving within states and you have a child with a pre-existing healthcare condition, you would like to know if the healthcare providers around you have uh, specialized healthcare providers. Like maybe you were looking for a someone that deals with mental health distress for LGBTQ patients, or you're looking for a doctor that works with heart defects, whatever, where you were moving to because of maybe your child or your husband or a member of your family has that pre-existing condition. For for data inefficiency, 40% of public health data remains underutilized and fragmented. Because of the lack of resources, we cannot harmonize healthcare data. So there's always, if you look at it, when I was in the Oregon Health Authorities, you can look at the data we're getting from a provider. And when we go to verify the data, there's a disparity in the data. Either they are giving us a wrong data or the data is inefficient, like they are making mistakes when they are transferring the data. But with Monimiz, we can give the data directly to health authorities because we are getting the data in real time from the hospitals themselves. Only 30% of healthcare providers have access to real-time healthcare data to make up informed decisions. And this is very prevalent in rural areas or areas with few healthcare providers because there is they are not imputing their data in real time. Most times when they go to impute their data, they have less information to improve their decision making for the hospital, for the patients, whatever. For the market itself, for the global health data analytics market, is projected to reach 80 billion in 2027 from 25 billion in 2020. The growing demand for localized health real-time data is very prevalent, especially in the US and around the world. Public health organizations, NGOs, and insurers require better tools to manage data and resources, which Monimiz can provide for them. So this is our revenue model. We have the freemium model where basically we have free subscriptions where people can get the basic model of Monimiz, basically where they can see the maternal mortality rate of maybe Houston or Providence, Illinois, wherever they are. They can see the output of each state or each region they are, but they can't see the individual hospitals, their patients' outlook. So the monetized healthcare system is where monetized one is where people subscribe, and we also have partnerships also where we have partnership with healthcare providers, government, and insurance, where we can show their network in full on our system, and it's also monetized. So the individual himself can get access to it by subscribing. So he can get access to the partnership part of it where they can see the real-time data of each individual healthcare provider around them. Then he monetizes healthcare resources. This is for individual providers. For example, if you're a pharmacist and you want to open a pharmacy in a region, you want to know if where it's easier to monetize your pharmacy, you can come to us. Like we can give you the data mapping of whatever region you want to move to. For example, if you want to move to Houston and you want to see what part of Houston it would be preferable to set up a pharmacy, we can show you. We can provide you if it's provide you a data map of Houston where it be where you can see which part of Houston is better for your pharmacy. This is just a revenue model with my when I was coding and looking at what to do. Now this is a detailed standout of what Monimiz does than all our other competitors. So healthcare map resources, we have very detailed localized data, while health maps, Zodoc and Google Health and the rest don't have that. Provider search. So this provider search is advanced where you can filter a healthcare provider depending on what you want. For example, if you want to search for providers within your insurance network, you can say, okay, I use this insurance network and I want a provider that has a doctor that works with hearts, uh, a doctor that works um with heart disease, whatever heart disease you have. There you can filter it and say, okay, this insurer has this hospital is in this insurance network and it has the specialized doctor the person requires. And from there, you can also book appointments because we also have appointments too. Also book appointments, which also Zodoc has. Clinical trial search. If you're a parent that you're looking for a clinical trial for whatever reason for yourself or family members, you can search on names to get that because we have partnership with clinical trial sites and clinical trial organizations. Healthcare outcomes and data integration. So we basically, as I said in previous slides, we will basically have real-time data, localized real-time data, localized data, and also personalized data. And this would be in a subscription model. We also have AI predictive analytics. This will be our partnership model, in our partnership model with hospitals. So we can help them manage their data well. For example, we can show them within the data they collect, we can show them trends that are happening that they are not looking at before it becomes a big thing. For example, there was a recent court case about a nurse that was breaking black children's bone in the ICU. Before it reached 7, we would have shown that there's a consistency with children, black children having their bones broken. Maybe after 2 or 3, we will not allow the hospital like, yes, in the NICU, black babies are breaking their bone unexplained. So we can provide that analysis to them through our AI models, our predictive models, so they can have it before it becomes public and so they can fix the problem before it becomes too large for them. Health data visualization. This is basically for disease outbreak, where you can see a heat map of disease outbreak within your area. For maybe there's an increase in STDs, there has been a link of whatever disease to maybe a grocery store, a foodborne disease outbreak from a grocery store. We can show you that we can show you a heat map of where it is. Like maybe it's in in HEB in Dallas. We can show you that, or maybe Fred Myers in North Portland. We can show you that also. And for the healthcare access, basically we can show you every provider available in your state. What are the what are government protocols if you're underserved community, what rights you have. We can also show you the links between state and government policies to your healthcare access. Basically a general information platform to show you everything about healthcare in your area, what resources are available for, you can search for that for people that make less than 30,000, for people that are poor, what are your access within the community for healthcare. And all this shows that why we're better than our competitors and whatever competitors are out there that I don't know of. Experienced leaders, as I say, I'm the only person right now that's working on this. I'm trying to look to hire a diverse team of data scientists, public health, data scientists, computer scientists, public health experts, and engineers to build up the platform to what I want it to be. Early wins and milestones. Early wins is that I have finalized the concept. I'm now looking to assemble a team. I have gotten, although this is not here, I have gotten a soft commitment from a VC firm, but the asterisk of that commitment is I need a lead investor. I have 4 behavioral health providers that are willing to partner with me at first in the beta testing stage of the platform. And I'm also looking to work I'm also looking to work with a local healthcare provider within Oregon to share their data. This is outside the behavioral health providers, as my primary healthcare providers. That's what I'm looking at. And also, I have a friend in a local health department that is willing to help me get a partnership with Benton County Healthcare Department. And I also want to initiate a partnership with a research institute, which I've not yet gotten. So the financial projection of this is within 1 year to 2 years of launch at 15 at $15 for our subscription model, and the premium model, which will have ads on it. In our first 2 years, we're expecting a revenue of 2 to 5 million from subscriptions and the premium model and government contracts, basically, within launch. Then 3 to 5 years where we expand out of Oregon to different states like Seattle, California, Idaho, Arizona. This is our second stage of initiating. We're expecting to get a revenue between 50 to $100 million within the 3 to 5 year period. The third year to fifth year of our company, sorry. Then when the AI-powered healthcare service comes into full fruition, where we can access that and put our AI-powered service into full fruition, we're expecting between year 5 to year 10, a conservative estimate of revenues between 250 million to $500 million. These are all conservative estimates, which my model has predicted. And this is a graph of what I think the revenues will be future. As I'm saying, I'm looking for an investment for our pre-seed funding of $3.9 million. The allocation of funds is broken into this. I can share you a detail of where percentages are going to. The highest percentage is going to building of the platform. Then the second highest is hiring the team, that is salaries. The licensing and compliances is the third highest. It's I think 15. This is 45, 35, then 15, 15, 15, and if I can remember. So this how the funding is going to be broken down for our investors so they can see the transparency within our Monimiz organization. Thank you so much. I really appreciate it. And thank you for joining us in revisionizing public health and healthcare data. My email is attached. My phone number is here, and the website is coming soon. Thank you so much. I appreciate it. Bye.